If you've been battling a bladder infection, you're not alone. In the United States, urinary tract infections account for more than 7 million visits to medical offices and hospitals each year. From the annoying symptoms of bladder infections to life-threatening urologic concerns, it's important to know the symptoms to look out for and the innovative treatment options available when it comes to your urologic health. To help shed some light on the issue, urologist and urologic surgeon Dr. Elizabeth Cruit of Baptist Medical Group is here with us today to share her expertise. Thanks for being here.
Good morning, thank you.
Well, I know you're one of the few, if not one of the only, or the only female urologist in the Pensacola area. Tell us a little bit about your specialty and how you went down this path.
Sure. Well, urology is a surgical subspecialty. It treats or deals with the urinary tracts of men, women, and children. And as a medical student, I really enjoyed surgery. But with urology, I was able to get the surgery aspect, but have a better lifestyle for raising a family, but then get to treat a wide range of patients. And there are not a lot of female urologists at this time, but it is growing. Now I think about 20% of training urologists are females, whereas 15 years ago it was less than 10%. So
you mentioned men, women, and children. Do you also treat people of all ages?
Absolutely. Yep, pediatric up to the elderly as well.
Well, tell us about some of the treatments, or some of the conditions that these folks may have.
My partners and I, Drs. Yale and Evans, we treat all aspects of urology, and so that involves cancers of the genitourinary tracts, so kidney, bladder, prostate, testicular cancer. We treat kidney stones is a big one. We treat enlarged prostates, male infertility, erectile dysfunction, and then also urinary tract infections, pelvic prolapse, and incontinence, which are big issues for women.
Well, with the urinary tract infections, tell us a little bit about what they actually are and what people can do, what people should be looking for or talk to the doctor about.
Okay, well, a urinary tract infection, urine is supposed to be sterile, so there's normally no bacteria there. When bacteria are able to enter the urinary tract and multiply, kind of set up, that's when you have an infection. If it's limited to the bladder, that's when you have the bladder infection, or some people call it cystitis. If it involves the kidney, that's when you have a more severe problem called pyelonephritis, and that's often kind of more associated with fever, back pain, and those type of things. The things to kind of look for with a urinary tract infection are going to be burning with urination, kind of a lower abdominal discomfort, an urgency or frequency to avoid, sometimes feelings of incomplete emptying. People can have blood in their urine, and then like we mentioned with kidney infections, and you also have the kind of feeling a lot more, being a lot sicker, having a fever or back pain. Those sort of things.
Well, are there risk factors, especially for the older population?
Sure. In general, risk factors are going to be anything that compromises your immune system. Diabetes is a big one. Pregnancy is one also. And then for you could almost consider being female being a risk factor, because urinary tract infections are most common in women. The problem or the issue is that most of the bacteria that cause urinary tract infections come from the intestines. E. coli is kind of the most common one, and for females, the opening to the bladder is closer to the rectum, kind of the intestines. Also, the tube into the bladder is a lot shorter in females, so it's easier for the bacteria to kind of invade and get inside. Then for women, as they get older, we go through menopause, lose estrogen, and that loss of estrogen really can affect the tissues in the genital area. The tissue thins. It also alters the normal bacteria in the vagina, and that makes it easier for bacteria to grow and become a problem. Also, if you're not completely emptying the bladder, that's a big risk factor. That can occur in men, often with enlarged prostates, but then also women, as they get older and have problems with prolapse, bladder prolapse, they may not completely empty their bladder, and that can cause a problem too. Elderly also are more common, or more likely to have Foley catheters or catheterization of the bladder, either because of illnesses or surgeries, and that's probably the #1 risk factor for bacteria being able to enter into the normally sterile urinary tract.
Do treatment options vary with age?
Not in general. Well, I guess to some degree, in that the initial treatment is usually the same. You find out what bacteria is there, you try to do a culture, you treat with antibiotics. But depending on age or sex, that's when you may be more concerned that there's an underlying problem. An older man that has a urinary tract infection, you got to think, are they not emptying their bladder because of enlarged prostate, something like that. A very young child, they normally don't get infections, and so you have to be concerned about, issues that are special to them.
Do you see more people seek out someone like yourself from when they begin to experience symptoms, or is this something that they should talk to their primary care doctor about first? How does that whole process work?
I think definitely, the first thing if you have symptoms is you go to your primary doctor. They're going to be able to, quickly see you, check the urine, give you antibiotics, and hopefully do the culture so we know that we're, effectively treating the infection. People are sent to the urologist, usually by their primary care doctors, when it's no longer kind of a simple infection, whether it's because it's recurrent or a persistent infection, or if there's concern that there's something, an underlying problem like, like I mentioned, retention or obstruction, a kidney stone, or even an abscess.
So at what point should someone seek medical attention?
With your primary care doctor immediately, when you start having the burning, the frequency. But then if you're having, recurrent problems, that's when you should go to your urologist, kind of have us check you out, make sure there's not an underlying problem, and then we can kind of, then we can talk to you about a special regimen for you, sometimes involving long-term antibiotics or, kind of some different things to help prevent infections in the future.
Well, you were mentioning antibiotics. What about treatment methods? Here again, I'm thinking about the elderly population who may be taking other medications. Is there any risk that some of these treatments may not work as good for one or the other?
Yeah, and sometimes you have to treat, with longer courses of antibiotics. Sometimes you do have to be careful, with blood thinners and things like that with certain antibiotics. So, there is some difference in the elderly.
What are the dangers in not seeking out help?
I mean, number one, there could be an underlying problem, a stone or, something like that really needs to be taken care of. But, given enough time, urinary tract infections, for the most part, they're pretty simple. They just cause, some mild symptoms. But, people can get very sick. The infection can spread to your bloodstream, and, it can be a very serious problem, particularly in the elderly. We definitely see that more.
The best thing is always to prevent things.
Sure.
Is there anything people can do to prevent having these urinary tract infections?
Well, I kind of, just recommend keeping the genital area clean and dry. Want to increase your fluids. Water is kind of the best thing, kind of keep things flushed through. And then go into the bathroom regularly to keep the bladder empty. The cranberry pills, people talk about, may be effective, but just in general, if you're having problems with the recurrent infections, come see a urologist, make sure that there's nothing underlying the issue, and we can kind of help go from there in preventing them in the future.
Great information, and thank you for being here.
Absolutely,
We appreciate it.